morning.
Okay. All right. Well, welcome
Thank you.
to Portland and all. Fill me in a little bit in terms of with the heart transplant program.
Mm-hmm.
Obviously, it's not on your watch. You know, you came into things in the middle of all of it and all that.
Mm-hmm.
But what do you do at this point when, you know, there's possibly a bad apple in the bunch, and it can be a struggle then to rebuild that program until there's a change made?
Mm-hmm. Mm-hmm. I think this peer review process outlined is a very important next step. The way this is constituted, and by the way, it's common for academic health centers like ours to use that kind of resource, a peer review committee, to ask questions like what can be better as we look to bring the program back bigger and better and stronger. So it is a robust process that's meant to look at policies, procedures, education, supervision, training, oversight, all those things that I referenced in the statement, and do that as quickly as possible.
How soon, realistically,
Mm-hmm.
could there be a program back up and running here?
I don't know. I think it would be speculative to actually try to put a particular timeline in for the program for its return, but I would say a couple of things. We have every intention of bringing the program back and bringing it back as quickly as possible, which means the peer review process that we will launch very, very soon, as you saw, is an important component, but there are other things that we're doing along the way. For example, we know we need to recruit, so we're already thinking about how we can use internal and external resources to facilitate recruiting.
Is it something that could happen by the end of the year, or is that too soon?
You asked me to speculate again. I would say it's probably too soon. That's based on past experiences with programs like this. I wouldn't say it's impossible, but months, 3 months, 4 months, it's very difficult to say.
What's your take on this so far?
Well, I think it's highly unfortunate, terrible for our patients in terms of the distress we put them through. Challenging and distressful for our staff members because many of them have, committed themselves to providing the kind of care that would be provided by a transplant program. So my take is I've asked, 3 clarifying questions. I've talked about that as I was coming on board. What's good, what's great, what can be better? Well, this is a program that needs to get better, which means that it's going to require our attention. There's a lot of detail work. We're already focusing our time and energy on getting the program back. So I would say, summarizing, we'll bring the program back. We will do what's necessary to bring it back as quickly as possible. And when we bring it back, if we look into the future, we're going to use this as an opportunity to make it even bigger and better.
What happens, though, in an area where it's not an issue of competence, clearly based on the numbers and what's always looked at. It has to do with personalities. It seems to be. It's a very intense kind of a program. Strong people are exactly what you want in a program like that. Leaders, those kind of folks. How do you get in a program like that more of a collective work going on? Cooperative.
Well, I think those are important questions to ask ourselves. So the tenets that I believe are important, and part of this is my responsibility, is to ask ourselves, are we being sufficiently patient-centered, and are we team-based? So the care for patients in the modern era requires a team of individuals, not just the physicians and providers. So one of the questions I'll be asking the site visitors, the peer review committee to ask us is, what is it, if anything, about the environment that we can improve? Because it is high pressured, it is high expectations, necessarily so, we accept that. But I think we need to ask ourselves, what can we do to make sure the environment is patient-centered, team-based, and supportive? So I expect that will come out. What I'm trying to say is those are questions I expect the peer review committee to ask. One of the advantages of that approach is that it is protected, and hopefully.
What do you mean protected?
Meaning that we'll create an environment where the staff members that are interviewed can feel empowered to speak openly and frankly about any concerns they have.
Meaning that they won't be exposed for, you said this, you said that.
Well, so in previous experiences, it's been a member of the site review team, site visiting peer review team will meet with faculty, meet with staff members, and ask themselves, well, what happened and why, and what can be done to prevent that from happening in the future? What changes are necessary to make the program better?
So are they protected, in other words, in the sense of they don't want any kind of repercussions if they speak up?
Oh, well, that would be an important. I talk about that in the sense of culture of trust. So one of the points of my message was to tell folks it's coming, but then the other piece will be there will be no repercussions for speaking frankly and openly about concerns they have.
What do you tell patients at this point who are in the program and really now are in a tough spot, and they're already in a tough spot?
Well,
is there anything more that can be done to help them?
Well, I would like for them to understand that as president, I take responsibility for this program. I'd like for them to understand that we will bring the program back. I'd like for them to understand that I am sorry and our providers are sorry for putting them through a very distressful change in circumstances. I can only imagine what that might feel like for a provider. And then the fourth thing I'd like for them to understand is that we are doing everything in our power to help the transitions of care. I want them to understand that any resources I have at my disposal as president will be used to get this program back up, but also to help them with their transitions in care.
One last question for you.
Sure.
How do you recruit at this point where people have all left, and again, primarily not because it was a bad program in terms of care and responsibility with the professional world, but it was a personality situation, it seems to be. How do you recruit people back in?
I think that's part of the peer review process again, where we will ask ourselves what are the messages that we need to make sure potential faculty members and others understand. My sense here after 5 weeks is that it's a marvelous institution with marvelous people who are truly committed to patient care. So it's not going to be easy, I suspect, but if we are able to communicate to potential candidates that we are open, we are direct, we are patient-centered, we are team-based, and by coming here and working with a team of individuals, you can contribute to something larger than oneself, which is to care for patients that have these devastating conditions. I think we can recruit. Matter of fact, I'm confident that we can recruit.
You already got a few?
Already have a few folks in mind. People are actually calling specialists asking if they can help in some way. And the reputation of this institution is outstanding. So I think we'll just have to be open, direct, and frank about rebuilding a program, but I think we'll do that.
Great, thanks.
All right, thank you very much. That was
Wonderful.
quick. All right.